if we think about self-compassion, it would be having a sensitivity, being tuned in to difficulties that I'm experiencing within myself, and then having motivation to try to reduce that. When we first started to look at self-compassion in people who have eating disorders, we were amazed to discover that it's almost like having low self-compassion was synonymous with having all the symptoms of an eating disorder. That it was just almost like it would be impossible to have an eating disorder and to have high self-compassion. But more interestingly, for 20 years, there was only one variable that predicted how much people benefit from treatment, and that was readiness. And for the first time, we looked at people's self-compassion and people's barriers to self-compassion. And what we found was, for the first time, we had a second variable that predicted outcome in our treatment programs, and that was having barriers to self-compassion. In other words, for people who are saying, for some reason, I think self-compassion is not a good idea, those people benefited less from our treatment. So that got us really interested.